I don't, an hour does that sound good or?
Yeah, so we'll chat for about half an hour and then we'll take questions in the chat, I guess, eh? Okay. All right, so let's go. So bonsoir et bienvenue à tous et toutes. Super contente de vous avoir avec vous ce soir. This webinar will be in English, but we'll be happy to accommodate those who wish to use French insofar as we're able to. The title tonight is Quebec on Strike, exclamation point. And in brackets, what the heck is going on in Quebec? For those people who've been hearing bits and pieces, because the mainstream media isn't doing much reporting about this mobilization we're seeing. So my name is Anne Lagacé Dowson. I'm speaking to you from Jojage, which is the Mohawk name for Montreal, on the unceded territory of the Haudenosaunee, or the Kanien'kehá:ka people. And I am the communications person with the Canadian Health Coalition, which is a coalition of unions, civil society organizations, and researchers, which was founded in the 70s to try and maintain and protect and uphold the Canada Health Act and the various provincial programs of Medicare. So on our board are representatives of the provincial health coalitions, as well as representatives of the unions and researchers. So we thought Tracy Glynn, my colleague, who's also on this call and who is the director of operations for the Canadian Health Coalition, we thought it would be a good idea to talk a little bit about what's happening in Quebec, because it's been decades since the Quebec government has faced off against a labor movement that is so cohesive and as well organized as we're currently seeing here in Quebec. Really, the last time it was this big was in 1972. And some of you will remember this is like a sort of a high water moment in Canadian and Quebec labor history. In 1972, the coalition of unions representing about 200,000 people went out on strike, and their demands were pretty minimal. They wanted $100 a week minimum pay. They wanted, like, the demands were very limited. I'm trying to remember. Minimum weekly salary of $100, job security, and an end to regional disparities in benefits across the province. Well, the Bourassa government, Robert Bourassa, the then premier, ordered them back to work. The leaders of the three big unions defied the back to work order and ended up going to jail. And so their names are sort of, inscribed in honor. Marcel Pepin of the CSN, Louis Laberge of the FTQ, and Yvon Charbonneau of the CEQ ended up going to jail, although their terms were shortened. And the outrage with which those terms was greeted by the population was something to behold. So there were wildcat strikes that broke out across Quebec, including the seizing of radio stations, stopping cabs at the airport. All kinds of stuff happened, and the government backed off. Bourassa went on to lose the election, and the PQ took power in 1976 in a landslide election, and immediately passed anti-scab legislation, daycare legislation, minimum wage legislation, basically providing the pillars of what we could call modern day Quebec. So that common front was in many ways the beginnings of what we know as Quebec today. A huge victory for the labor movement. Now, today's common front is up against a very conservative provincial government headed by François Legault. He is a former Péquiste who founded a party called the Coalition Avenir Québec. He himself is a certified accountant and millionaire. His health minister is a certified accountant and millionaire. It's a very conservative government, and they are facing now, after about a month of strikes by 500,000 public sector workers, 80% of whom are women. So it's a big deal. It's a very big deal. And it has been quite something to witness. I have a daughter who's a recent nursing grad who is headed to becoming a member of the nurses union here. And she goes off to help and support the picket lines. And our guest is also a well-known activist and nurse. In fact, she has a doctorate in nursing. Her name is Natalie Stake-Doucet. She's an assistant professor at the University of Montreal, a board member of the Quebec Nurses Association, and a person who does all kinds of great things, including volunteering at the Native Friendship Center with Médecins du Monde. And she joins us now, also from Montreal. So welcome to our webinar tonight, Natalie. It's great to talk to you in this context.
Hi, it's so nice to be here. Thanks for having me.
So the current Common Front is composed of the four big, what we call union centrals in Quebec, the CSN, the CSQ, the APTS, which is a union of medical health workers, and the FTQ, which is the big CLC affiliated union central. So they are the core groups. And then there's a union of teachers called the FAE, which is about 65,000 people. And there's the nurses union, which is also not in the Common Front, of about 80,000 people. So altogether, that's roughly 520,000 public sector workers. And they have widespread public support according to polling that's been done. The public is pretty much behind them. So let's start by talking about the fact that most of these strikers are women. This is a very big deal, I think, that hasn't really been fully addressed. Up to 80%, you were reminding me just before we came on. So tell me
and probably
how pardon?
it's probably even more when you factor in the nurses.
Right. Who are 85% women. So how important
90%.
is that dynamic of the fact that these workers are mostly women and the people they're facing off against are 60 something, successful
Old rich
businessmen,
men.
pretty much. Yeah.
Yeah. So I think for me, this is a little bit the new face of the women's movement. I don't think we should call them waves anymore, but there's definitely at the heart of this strike are definitely feminist issues. A lot of the demands are just basic recognition that the people who are doing this work, teachers, school support workers, nurses, licensed practical nurses, respiratory therapists, people who work sanitation in hospital, who work in the kitchens. It's really every single level of work that's done in hospitals, schools, social workers, physiotherapists, etc. None of that. If that work is what holds up the entirety of the public services system in Quebec, and yet people who do that work that really hold up the system are the ones that are paid the least. And it's not just about pay; it's also about respect. There's a lot of devaluing of our work. There's a lot of we've seen the premier say publicly, for the good of the children, you should go back to work. There's a lot of guilt tripping, which is things that we see every day as women in the workplace, where we're guilted into working more for less money. So yeah, for me, it's definitely a feminist strike. There's no question.
So, and I was just reminded, one of the things that François Legault, the premier, got into trouble for is at one point he tweeted in French, he said something like, I hope people won't think I'm sexist, but everybody knows that women don't need as much money as men.
He said girls are not
Les
interested
filles ont
in.
besoin moins d'argent que les gars. I was like,
Les filles sont moins. He said girls are less interested in salaries than boys. Yeah, that was.
Yeah, so that's the
our
guy
premier.
who's giving the marching orders to his Treasury Department people, the people who are negotiating with these unions. I mean, it seems like it's the 1950s that has banged up against 2023 or something. There's some kind of culture clash there.
It's definitely something straight out of the 50s. He himself has often mentioned how he admires Maurice Duplessis, which was the premier in the 1950s, who was, infamous for the repression that happened in Quebec up until the 60s when he finally kicked the bucket. But yeah, François Legault, our premier, often speaks about this horrible person in our political history as one of his political idols.
So one of the details of this, the Common Front, the main pillars of the Common Front, the four big unions, and then the two other unions that are not affiliated with the Common Front, is that the teachers and the nurses don't have a strike fund. So as a result, the steelworkers came forward with $100,000 of support for the teachers union to try and help tide them over, because they've been out since November 23rd in an unlimited general strike. So this no strike fund thing is kind of shocking to me. Can you explain to me why that would be the case?
I think it's also a reflection to a certain degree of the weakening of the labor movement over the last 20, 30 years. We've seen, consecutive attacks by government after government against unions, against the labor movement in general through austerity measures, but also various laws. essential services laws, things like that, where we're not even allowed to go on strike unless we respect some impossible conditions. And so for the nurses union, I think part of the rationale was that, well, since we're not even allowed to go on strike, what's the point of having a strike fund? For the teachers union, it's a fairly new teachers union. It's part of a scission that happened in the 90s, I believe, or maybe early 2000s. I can't remember the exact year. So the FAE is only teachers, whereas the other teachers unions have some technical people or support staff, like people who take care of the after school daycares, things like that are also in that union. So with the FAE for the teachers union, I'm not sure what the rationale was behind that. It's clearly not ideal when you're going on an unlimited general strike to not have a strike fund. And so we're seeing a lot of teachers now take up, Uber Eats gigs to make ends meet. And there's a lot of really beautiful mutual aid groups that have also sort of emerged, organizing to, bring food baskets and things like that to the picket lines. And there's a lot of, they're asking a lot for like gift cards for, grocery stores or just prepaid gift cards to give to teachers.
These are the same people who, in the beginning of the school year, will go and buy supplies at the dollar stores and bring stuff into the classrooms for lack of resources in the schools. My daughter was reminding me of the fact that her teachers in primary school did that.
Nurses do that too, actually.
Do they?
Yeah, I mean, we've had it was in the media a lot, but a little bit, few articles. But I've known a lot of colleagues who, even when I was the nurse at the hospital, sometimes we had we knew of nurses that had to fundraise to get like blood pressure machines, things like that. In Quebec City, in just before the pandemic, it went into the news and made a bit of a scandal which is a good thing, because the nurses didn't even have they didn't have the equipment that they needed to do just their job. So they had to fundraise for that. And, I mean, patient care is obviously affected when you don't have the tools you need for your job. And it's not normal that, for public services, some of the most basic stuff that we need to do our job are not available to us.
So it's a feminist strike because the vast majority of the strikers are women, or people who work in what are considered to be overwhelmingly female-dominated professions. And the issues are ratios, the number of nurses to patients and teachers to students. And then I guess also the whole question of salary and pay levels, because Quebec's nurses and teachers are the lowest paid in the entire country. It's specifically really noticeable in the nursing profession, but it's pretty bad for teachers as well. Whereas we have the highest paid elected provincial politicians in the country. They just gave themselves a 30% pay hike. François Legault and his cabinet. And we have the highest paid doctors. How do we reconcile all of that, Natalie? How does that all play out?
Well, I mean, again, what's the difference between MNAs, physicians, and teachers and nurses? I mean, the main issue there, I think, is gender and gendered work. So, gendered work shouldn't mean sexism. The problem is not that there's too many women or not enough men in this job. It's the kind of work that we do that's considered women's work. So like a nurse, even my colleagues who are men who do nursing, or who are non-binary who do nursing, they're still considered as doing women's work. And so they suffer the consequences of that sort of sexist devaluing of care work that is absolutely fundamental to society. So, our MNAs, what's very frustrating is that, our premier understands the importance of retention. When he gave himself and his MNAs a 30% raise, he said, it's important to retain and attract good people to have good salaries. And, they've been screaming about a so-called nursing shortage for years now. And it's like it never crossed their mind that perhaps making working conditions a little bit better would help keep and attract people into the healthcare system. But when it comes to our jobs, any retention perspective that they have for their own jobs, they are just unable to conceive that it could possibly be applied to nursing or teaching or social work or any of those kinds of jobs.
Meanwhile, so this fight is playing out over around negotiating tables between the Common Front and the various representatives of the Quebec government. But meanwhile, over the weekend, the CAQ government, the Coalition Avenir Québec government, headed by François Legault, invoked closure and jammed through a massive reform of the healthcare system called Bill 15, which is now Law 15. Mm-hmm. In the manner that they have become, known for, which is to just push stuff through. Law 21, Law 96, like these are measures that were highly controversial, and they just rammed them through. This healthcare reform.
They did an education bill, Bill 23. They did the
also,
same 2 weeks ago.
Right. So they pushed this healthcare reform bill through against the backdrop of a huge amount of tension and these failed talks. So how do those two things fit together? That massive reform against the backdrop of a generational amount of labor unrest.
I mean, there's a lot of layers to that. I think, in healthcare in Quebec, all of the last major reforms of the last 20 years have been pushed through without discussion. They've invoked closure for every single one. Since 2003 with Couillard, then Couillard again in 2006, then Gaétan Barrette in 2015, and now. So they keep just pushing through these massive healthcare reforms without discussions, without study. And the healthcare system in Quebec is a giant bureaucratic monster that you need to understand before you decide to play around with it. And, just before they invoked closure and just bulldozed it through, there had already been 500 amendments only to correct mistakes within the bill itself. So mistakes, stuff like, not identifying a job title, probably not understanding how different services work or are organized and things like that. So it's not even amendments to change, to question whether it's a good or bad reform. It's just simply correcting mistakes, because our health minister has a very, very narrow and insufficient understanding of how healthcare works. And now on top of that, with negotiation, what's that going to mean for negotiations? How is that going to affect, the union demands? What is it going to look like on the ground? It makes the situation a lot more complicated, for sure.
And there are those people who are on the webinar right now from Alberta will recognize a little bit about this Law 15, because it is a kind of a similar, or it echoes Law 30 in Alberta, which brought in the Alberta Health Agency and allowed for privatization of surgeries, among other things. Like this new law that's just been passed in Quebec talks about opening 2 private hospitals, opening up private surgeries. It's a very similar agenda. And I suspect the public servants in both provinces and the politicians in both provinces talk to each other about this. So it's bad news for the healthcare system. And so it makes me wonder, like, the role of labor in saving healthcare from these corporate politicians, these corporate-minded, profitizing politicians, because we know that in 1962, when healthcare was introduced in Saskatchewan, it was massively supported by the unions in Saskatchewan. And then again in New Brunswick, where Tracy is, Louis Robichaud's government brought in healthcare. After Saskatchewan, it was New Brunswick. And again, the unions played a big role. So I wonder if I'm being overly optimistic in thinking that this will galvanize labor support to try and patch up and save the healthcare system from these nursing agencies and these private long-term care owners and all of these people who are trying to make money off of the healthcare system.
Well, I mean, the main problem with the privatizing of the healthcare system is our health minister right now, much more than agencies or even the private long-term care homes. The healthcare system is already highly privatized in Quebec. I mean, physicians here, the vast majority, like 88, 89% are a fee-for-service. They're considered subcontractors of the healthcare system. So if ever you get care from a physician in this province, it's essentially private healthcare. So this strike is absolutely for the soul and for the survival of public services in this province. This government is not the first one to promote the private sector in education and healthcare and social services. Every single government since Bouchard in the 90s has pushed for more private sector especially in healthcare. And Quebec is one of the provinces where physicians are allowed to work at the same time, both in the public system and the private system, which creates a huge conflict of interest and really takes away a lot of resources that we need for the public system into the private. Physicians are even allowed to rent MRI machines and things like that. Well, maybe not MRIs, but equipment within, super specialized equipment in hospitals and things like that for private patients. And so, it's the same people, it's the same workers that are in both. And so the more you get to the private, the more you take away from the public sector. And so, nurses and teachers and everybody who works in the healthcare system, lab techs and social workers and physiotherapists, we've been holding up what's left of the public system for many, many, many years now. And, at one point, enough is enough. We're trying to hold on to what little is left and push back the wave of privatization. And it's a hard battle, but people are in a great mood on the picket lines. It's, I think, especially with nurses, I'm a nurse, so I go on the nursing picket lines pretty much every day. But we've been so kind of run over for the last 20 years so often. It's just it feels so good to be fighting for rights in a formal way, all of us together, we're out and we're able to be part of a broader movement, because even if the FIC, our union, isn't part of the common front, we're still going on strike at the same time. We're still doing marches together. Yesterday I went to a protest against Bill 15, and it was all the unions from the common front and the FIC. Then we walked to 2 picket lines of the teachers who were on unlimited strike. So it was super fun. Everybody yelling, screaming, dancing, and it was just very, to see that level of solidarity and how easy it is to go from one picket line to another. Schools, clinics, they're everywhere, right? They're the hearts of a neighborhood a little bit. And so I feel like whenever we walk outside, we see a picket line, and we hang out, talk, and exchange about our working conditions. And we really understand, especially with teachers and nurses, my God, we have a lot of things in common, having to buy our own stuff for work, having to, they keep increasing the patient load without increasing our pay or and it's the same with teachers. They say, oh, but you're just giving class. Yeah, but last year I had 26 students. This year I have 30. Next year I might have 36. And, it's not safe. We just want to do our job. Basically, we want to be able to care for people. And, I worked in a CHSLD once, and I was working for an agency at the time because the public system didn't want me part-time. But I had 178 patients in my care, and that's,
So just to say to those people, CHSLD is a Centre Hospitalier de Soins de Longue Durée, so a long-term healthcare
Centre
facility.
d'hébergement de soins de longue durée, yeah. So it's a long-term care facility in the public sector. And yeah, I mean, the ratios that we have right now, there's no limit. So one day, if I worked at the hospital, I could go in, and one day I had, I don't know, let's say I used to work in the emergency room. I was technically never supposed to have more than 6 patients at a time. But, they could change that tomorrow and say, oh no, finally today you're going to get 10 patients. And there's nothing I can do about it. But if I make a mistake or if something happens, then it's still on me as a nurse with my professional responsibility, and so nurses are sick of that. It's impossible to give decent care when you have that many patients. And we don't want to do it anymore. It's not a fulfilling job anymore. And that's why we don't really have a nursing shortage. We've never had so many registered nurses in this province, but nurses are just fleeing the public healthcare system because after 20 years of propping it up and doing everything that we can to keep it alive, instead of being valued for that, we're just, they just keep stepping on us even more. So at some point, people get demoralized and just quit. Right. They leave,
or they go, or they go on strike. So hence the importance of these mobilizations. So today was the last day of a 4-day block of strikes. So tell us what the next step is. So there's been 3 waves of strikes in the healthcare sector and in the education sector. Mm-hmm. What's next for the Common Front and the 2 unions that are affiliated with, or allies of the Common Front, the teachers and the nurses?
So for the Common Front, this was the last. They have a mandate for unlimited strike. So they decided not to apply right away. So they've gone to, so the first wave of strikes was at the beginning of November, I think, and first it was 3 days, then 4 days, and now this is the end of a week week of strike for the Common Front. And then if nothing is done by the new year, then in January would be the beginning of sometime in January, the beginning of an unlimited strike for the Common Front. For the teachers, the FAE, they've been on unlimited strike since November 23rd. So that's mostly teachers in the Montreal and Laval area. So it's about 65,000 teachers, I think. And for the nurses, we're not allowed to go on unlimited strike. So the law here, the essential services law, says we need like an essential services plan. So it's a more complex thing, but we could vote for a longer strike for sure, and eventually get to unlimited strike. But there will be more strike action if it's not done by Christmas, and it's highly doubtful that it will be, because the government doesn't seem to be paying much attention to this.
So apart from the appeals that the premier's made, to the teachers, think of the children,
yes,
which I found so ironic. Think of the children. Talks have been going on for a year, and I think the teachers do constantly think about the children, Mr. Premier.
That's their job.
Tell me what you're observing of public support or opposition. What's your sense of how the population is feeling about this? Because the polling seems to show support, but I wonder if that's waning, or what your sense is from having been on the picket lines yourself.
I mean, there's always, in the media, they're always going to try to find that bro or that dude that's like, oh, they should go back to work, they don't know what they're doing. But in general, I mean, I went by 3 picket lines today, and just the honking was constant. This is a really big strike. Like at the peak, I think at the beginning of November, there was even more unions that joined in solidarity for the strike. So I think one day we had like almost 700,000 people go on strike the same day, and that's like 10% of the whole population. So, and one thing that's sort of striking as well is everybody knows a teacher, everybody knows a nurse, and people generally like teachers and nurses. They know that we don't go into these jobs to like make the big bucks or anything like that. It's absurd to think that anybody would do that for that. So I think it's clear to people that we're in these jobs because we want to help people, and we believe in the public services and public education, public healthcare. And so that makes it difficult for the government to say, oh, we're just a bunch of greedy bastards who want more money. We do want more money. We need more money, but that's not really what's at the heart of the strike. So in general, I think support is massive right now. That being said, it's important, we can still be on strike without public support. We want it, but I don't think it's the most important thing. It's the value that we give to ourselves and how much we believe that what we're doing is the right thing for public services. And I think right now that belief that we have no other choice than to go on strike, and this strike is righteous. It's a good strike. It'll help long-term patients. It'll help patient care. It'll help education. It'll make the world a better place in a way. I think we all have that feeling deep down, and that's what drives us, the same as what drives us every day. We're caring for people, teaching people.
So for those people who are on the webinar who are in other jurisdictions outside of Quebec, you mentioned the word solidarity is really important between the different unions, between the non-unionized population and the unions. And I'm wondering what you would suggest or might be a possibility for those people who are already, curious and interested and feeling like they would like to do something in support of what's happening in Quebec or show some kind of, make a gesture of some kind. Like in 1999, when the nurses went out, they were fined massively by the Quebec government, and the union movement across Canada rallied around and helped pay some of those fines. Quite a lot of the money that paid those fines came from the Canadian Federation of Nurses Unions, the Alberta Nurses Association. So I'm wondering what, if any, solidarity could be conjured up at this point, just at this critical moment before Christmas, because after Christmas, things could get long and cold and hard for people coming back.
So for sure, like the ones who need the most right now are the FAE, so the Fédération Autonome de l'Enseignement. So the teachers that have been on unlimited strike since November 23rd, they don't have a strike fund. So, we have, so we need donations to that union. So the Steelworkers Union gave $100,000, which is good, but it's not enough for 60,000 teachers. So, anything, I can put the website of the union in the chat. There's also a mutual aid group on Facebook that I can put the link to as well. They do, like, every week they have like an event where you can send gift cards, or you can send, food baskets, things like that. And they have like a list of people and specifically what they need and things like that. There's a lot of, but yeah, we need support money. Talk to your unions, talk to your, NPs, talk to, I don't know if there's like, just this little webinar I think is really fun because we feel often very isolated in Quebec from the rest of Canada. We call the rest of Canada the ROC.
The rock.
Yeah, the rock. And so it's nice, it'd be nice to sort of rekindle that sort of esprit that we had back in the 70s when we had, walks from Ottawa and Gatineau and meet on the bridge, and, support each other through, donations, but also through action. I think that's definitely important.
I remember in 1999, which is, I think, that was sort of a key moment for you as a young person. That was a really impressive showing of support and solidarity from across Canada for the Quebec nurses. And I think as each of the provinces faces off against its own struggles, this will be something that we'll probably all need to be thinking about. And also, I'd invite people on the webinar, if you have a question, just throw it into the chat and we'll see if we can't address, or maybe Tracy needs to intervene. Sorry, go ahead. Yeah.
It's in the Q&A.
Oh,
go
sorry,
to the Q&A.
Right.
A couple of questions.
Okay, gotcha. Okay, here are two questions. One from Mary Ellen McElmoyle, who says, where can we donate? Unifor Local, well, the Unifor Local, I guess that she belongs to, would like to send support. So maybe we can put that information in the chat, Natalie. And then Charles Pitts is asking, could you talk about long-time cuts to public services as a strategy to then promote privatization as a cynical solution to the problem of failed services? Which is a very good question. And I'm going to throw in a third one as well from Trevor Zimmerman, who says, are the post-secondary staff on strike? And what about the students? So the answer to that is yes, the post-secondary staff is on strike. That would be the CEGEP staff. The FAE teachers who are in difficulty because they have no strike fund are mostly primary and high school teachers. So all the teachers basically that aren't university teachers are out on strike. Okay, so
but we might go out. We voted for 97% for strike last week.
Who did, the university teachers?
Yeah, my union, the SUPUM, U of M. We haven't been on strike in like, well, we haven't. I'm a brand new professor at U of M. I started in this summer, but apparently there hadn't been a strike vote in 15 years or something like that. So
wow, okay. So that would be something if all of you joined the picket lines. That's a lot of people.
Yeah. Oh yeah, for sure. And so the post-secondary staff for us, Quebec is different. We have like CEGEPs before university. So we have like high school, then college, then university. So the CEGEP people are on strike. I went to one of their picket lines last week. And most of them are with the teachers union that is part of the Common Front, but I think there is one or two CEGEPs that might be with the autonomous teachers union that have been on unlimited strike since November 25th.
Okay.
And just on the somebody asked about the like the eroding of public services and then providing the answer as privatization. That's, I mean, definitely, you know, our health minister, Christian Dubé, says we need the big guns. He literally called them like that, the big guns from the private sector to show us how it's done. And he actually wants to, in his new reform, to hire contractors from the public sector, from the private sector, that would be paid millions of dollars to sort of manage the transition that he has in his health reform. There's an incredible amount of money that's being funneled into the private sector through physician cabinets. And it's just wild to me that, you know, I'm against nursing agencies, don't get me wrong. I think they're terrible, but they are a symptom. So like nurses are tired, they can't handle working in the public healthcare sector anymore because we have forced overtime, we have no life, they won't let us leave. You know, during the pandemic, one unit manager actually locked the doors to stop the nurses and the orderlies from physically leaving the unit. They were locked in. There's, you know, and so I'm pretty sure all the nurses who are on that unit quit within the weeks or months following that incident, because you don't want to stay in a job that treats you like that. So nursing agencies I see them as vultures, right? So like the healthcare system is dying of thirst in the desert and there's vultures circling. That's the nursing agency. So you can shoot down the vultures, but if you don't give water to the person that's dying of thirst, they're still going to die. So nursing agencies are not good, but they're a symptom of what's happening. And that our health minister targets agencies, to me, is absolutely wild, because he says that's the problem with the healthcare system, and yet he's funneling billions of dollars into private healthcare. But yet it's only when nurses try to find a way out, and then it's bad. So we're being punished for trying to have a life. And agencies aren't like paradise. They're better than public healthcare system right now, but I've done both. But you go to agencies basically when you want some kind of control over your life, because at least with agencies you can have, you know, they can't force you to do overtime, and they can't impose a schedule. So, you know, you'll still work nights and evenings, but you have a bit more control, and they can't like surprise you with a shift when you had stuff planned. So it allows you to give to just have a life outside of work. Which
the agencies are also union busting, right? Because there are no unions in the agencies.
Oh yes, they are. Some of them are. Yeah. So
are they? Okay.
Yeah.
Okay.
There's the FIC privé. So mostly it's private, but I think there's one agency that's unionized, and regardless, because you can be an agency work and work for a long time in the same place, right? So you could work months and months and months. And if you work for many months in the same place, you have the union protection.
Okay. So just to go back to the questions here. So we answered the question about the post-secondary stuff. So here's a question from our friend Chris Galloway in Alberta. Who or what sparked the public sector unions to coordinate in solidarity around this particular round of bargaining? Like what was what galvanized this high level of cooperation between the unions?
Well, I think, you know, the pandemic really was brutal for the healthcare system and the education system. So, you know, elementary school, high school teachers, nurses, we were thrown basically into a meat grinder and told, you know, deal with it. And you know, we were called, people were clapping at night, blah blah blah, all that stuff, and you know,
and you were what did the premier call
guardian angels,
guardian angels, les anges gardiens, yeah.
Yeah. And so, you know, I think with all that discourse around how wonderful and amazing we were for accepting horror for 3 years in our working conditions, because the government essentially dealt with us by decree. So all our collective agreements were thrown in the garbage because of the emergency, the Health Emergency Act. And so they just put act after act, decree after decree, forcing us to work in just absolutely horrendous condition, which again led to massive, massive, massive quitting by healthcare professionals, health workers, and education workers. And so now, after all this, we're like, okay, we deserve a break. We deserve a little bit better. We've been busting our asses. We've been through the grinder. We're tired. We're traumatized. We're hurting, and we need help. And what the government has been offering is an insult, really. And so after what we went through the pandemic, I think, I used to know a lot of nurses who were often a bit afraid. They're like, oh, I'm not sure we should do this. A strike, could be, is it illegal? Things like that. And now they're like, you know what? Screw them. I'm not afraid anymore. I'm just really, really angry. And right. So that anger, I think it's just like a overflow of anger of everything we've gone through that has really just, it's the dominant emotion now. And there's the guilt and the fear doesn't matter anymore. That's all moved towards anger.
And I'm seeing it a little bit in the mainstream media. I'm seeing nurses speak out in a way that I have never heard them speak out before. Like there's always been a kind of a reserve, devoir de réserve, a certain kind of feeling that nurses should not diss their employers, that they shouldn't speak out about exploitation in the workplace. And now they're just having they are letting it all all out. And it's like, I think it's shocking. A lot of people are like, oh, wow, we knew it was bad. But listen, I heard that nurse on the news last night. So suddenly there's like a liberty of expression, freedom of expression that we haven't heard. I just wanted to mention on the question of pay scales. So the FIC, the nurses union, is asking for 20%, a 20% increase over 4 years. And so far they've been offered just short of 13% over 5 years, which is a joke. I mean, that is so that also would galvanize a lot of people to say, well, the gap between what we think would be just survival and what they're offering us is so terrible that what the hell, why wouldn't we go out on strike? Okay, so here's
we've got nothing to lose at this point. I mean, we can work for agencies, we can work in other provinces. A lot of nurses are going to Ontario or New Brunswick because the difference in pay is so big. Like we're not just the lowest paid, we're like by far the lowest paid. Like at the starting wage, if you work full time, your first year, it's about a $23,000 a year. That's almost $2,000 a month less, that you make when you work as a nurse in Quebec versus, if you're in Gatineau, for example, you drive an extra 15 minutes and you get, almost $24,000 a year more for the same job. So yeah, wow. It's a lot. The gap is just huge and it's unjustifiable.
It is unjustifiable, and it has to do with, I think, what you were describing earlier, the sort of built-in sexism, which is the next question here. Don't we actually need this to be a pan-Canadian strike? Alberta and Ontario are having these same problems, and the issue of privatization, overburdened and underpaid workers in so-called women's fields is a much larger issue, not just unique to Quebec. So I mean that would be ideal, is if everybody.
Yep. And that's, I mean, it's interesting because the world right now with social media and stuff, it's a lot easier to get to know people. Like there's a whole nursing community on Twitter, on Instagram, on Facebook, things like that. And that we use a lot and we talk to each other a lot through that. And so, there's podcasts and this and that. And so it's a lot easier to talk to our colleagues, in the ROC than, before there was all that. And the last time there was a strike of this magnitude, there was no internet. There was no, these things didn't exist. So, to get our side of the story out is a lot easier, and to build relationships and networks of solidarity support is much more feasible.
So that was a comment from Bev Mendel Atherstone. And here's a comment from Catherine Newman. I second the question about post-secondary education. I'm curious about what working conditions are like in Quebec and how teachers might be fighting back.
So a big chunk of the universities in Quebec are private technically, so they do get some public funding, but their public services are very complicated in Quebec. Like I call it sedimentation. So they make rules just on top of each other forever, um, and like when you go in a hospital, sometimes there's forms. You don't want to go through everything, all the forms that have already been done, so you just make a new one, and another version of it probably exists somewhere, and so we just build this giant monster. Um, in universities, there's quite a difference in pay. So last year, profs from 2 universities went on strike for about 5-6 weeks, and got pretty good. All our contracts were more or less at the same time, but they managed to get their contract within, quicker than we were, because we've been without a contract for just over a year now. And right now the university is offering us, like the university's offer is basically saying, well, we're gonna offer you, we're not gonna tell you what the increase is. We'll calculate it when we get there over the next 5 years. We have our own calculations about inflation and this and that. So they're expecting us to vote on an offer that doesn't even have actual numbers in terms of pay increase, which is, I think they're probably, maybe they want a mediator, because they really sound like they're negotiating in absolute bad faith. We're trying to get some, recognition for the amount of, when you're a professor, you supervise students at the master's level, PhD level, and things like that. But like where I work, we don't get credit for that until the person actually graduates. So, I could be supervising somebody for 2, 3, 4, 5, 6 years, but that's not recognized as part of my workload until that person actually graduates, so, and gets the PhD. So that obviously makes no sense and is not particularly useful. And there's quite a wage gap between universities as well for professors, depending if it's a research university, a teaching university. We're supposed to be a research university, but we're the lowest paid amongst the research universities in Canada, and they're the ones that are supposed to be more competitive. So yeah, there's a lot of issues on the table for sure.
That's Université de Montréal. Somebody who added an adjunct question to what Bev Mundell-Atherstone raised, which is, which she's the person who said, don't we need this to be a pan-Canadian strike? Alberta and Ontario are having the same problems. And then Corinne Spencer jumped in and said, this is my thought as well. Alberta's restructuring of the Alberta Health Services, while it's already crumbling, will completely wipe out public health care.
Yeah. So yeah, Alberta, every news I get coming out of there sounds like dire. So for sure. But at the same time, I hope that's what's going to galvanize the labor as well. So, you gotta, when they attack, we have to fight back, and fight back, we learn, and we join together, and it makes us stronger for the next wave. So the thing I tell all my colleagues is, we got to remember, we'll still be there after this government won't be anymore. They got Legault has 3 more years to go maximum. Obviously we want to win this round for sure. But everything that we're building right now, just in terms of how much we know each other, how we're all these networks of mutual aid and support, and inter-union solidarity, are things we need to keep alive, regardless of the outcome of this particular strike. Whether we win or lose, this is something that we want to build and we want to keep, because this is something very precious, and this is something that's going to inform future movements as well.
Right. And I would also, like, when I talk to my daughter, who's 23 years old and just got certified as an RN, and she's all, she's young and gung-ho, and I would sort of have sometimes find myself saying, so sort of old fart things like, well, okay, this is new. Nobody's done this since 1999. A whole layers of the population are learning how to do this because it hasn't been done in so long. So, in that sense, what you're saying is really true, is that this is a watershed moment, and new structures, new networks are being created where there really haven't, like a whole layers of the population have gone off and retired, and a whole bunch of new people are stepping into these roles. So this new version of the Common Front, these new union leaders are learning as they go, and some will become more militant, some will drop away, some new ones will pop up. Like, it's a It's a
But
big
I'm like,
moment.
you see the creativity with the picket signs and stuff like that. That's always something I love to do. And I've seen so many openly feminist signs. Like, one of the sign was this nurse holding a sign saying, this Barbie deserves a Ken salary, in reference to the Barbie movie and things like that. And
Right.
then there was another one, because the premier said that he wouldn't give us a more of a wage increase. But then he turned around the very same day, he gave $7 million to the richest hockey team in the National Hockey League, the LA Kings, who are already millionaires. They don't, to the point where it actually made the players of that team uncomfortable, and they wrote a letter saying, this is not, we didn't decide to do this. This is really your government deciding to do that. And so a lot of people, had signs to the effect of like, you got money for the kings, but not for the queens. And so, that's sort of, uh, you know, how we refer to ourselves. And, I think, especially with the pandemic, one of my colleagues at the University of Ottawa, one thing she says, if there's anything the pandemic proves, that nurses are worth $100 an hour, and this government has gleefully given almost $2 billion to private agencies to get nurses into the public healthcare system. So we're just asking that he give us that money instead of private agencies. And so I
Well,
think
and
there's
also
this.
just for people who aren't aware, so the Legault government lost a key by-election in a riding called Jean Talon in Quebec City.
Yes.
And the premier was so stunned by this that he couldn't figure out what to do. So all he could do was what, a conventional dad guy would do, which is to say, oh, well, the kids are mad, so I'll take them to a hockey game. So he threw $7 million at the LA King to play 2 exhibition games next year in a city where there is no hockey team anymore. The Nordiques have been gone for years, right? This is all that the
Decades.
premier
Yeah.
could think to do to try and shore up his
Give them
support.
games.
It's so laughable that the Kings, the hockey organization, as you were saying, were kind of like, wait a minute, what? Anyway, so yeah, it's really not working very well for him.
No.
Anyway, so I guess we answered the question from Catherine. We answered the statement from Corinne. Has anybody else got a question? Oh, here's a comment from Alberta. Hello from Alberta. Very interesting. No question. Just want to say thank you for this. So you are more than welcome. I'm really glad that people were able to join us. And I guess that's it for questions, unless somebody
And
wants to
thank
throw a
you,
last one.
Pam. Another RPN. You're awesome. And I really hope that we contaminate other provinces with our strike movement.
Yes, exactly. Oh, sorry. Here's
Feels
Cynthia
like,
Wagner. How long did it take? How long before you started to prepare your members for the eventuality of being on strike at the same time?
oh, that nobody was prepared.
No one was prepared.
Yeah, it kind of happened. I think there was a lot of discussion. There's been a lot of discussions for a few years now. But I think the Common Front was helpful, at least for nurses, to sort of push our union leadership a little bit in the back, say like, hey, come on, the members, nurses have been itching to go on strike for a few years now, and
Well, so why are the nurses not formally in the Common Front?
this union is never in the Common Front, so that's unfortunate. I mean, I don't. The rationale is kind of obscure, like, oh well, we don't have the same kind of schedules because the Common Front. So the Common Front can sometimes have a weird structure. So the initial Common Front in 72 was like, okay, we're all negotiating together, and as long as we don't all get the same thing, we're out on an unlimited strike. So this time around, I think there was 2 or 3 other Common Fronts since then, but the last one was in 82. So we haven't had one for a very long time. We have, hundreds of thousands of people and different negotiating tables. And so we're not all in an unlimited strike yet. So what does that mean exactly? I don't think it's perfectly articulated yet exactly what it means to be in this Common Front. And it's probably going to get tested if this government gives something to one side and not to the other. That's kind of like the classic thing that happens. And so I think despite that we're not officially in the Common Front, we're still part of the broader movement. But yeah, I mean, I think our union leadership for sure is still very shy, to put it mildly, about, this level of mobilization. They're not used to it. You haven't had that since, for 50 years. And, the last 50 years have been just wave after wave of union busting, and, you know, special laws and things like that. You know, for the nurses, if we're on an illegal strike, for every day we're on the picket line, we have to work 2 days without a salary. And this is legal in this province. So if we spend a whole day on the picket line, then we're subtracted 2 days of work. So we basically work 2 days for free for being on the picket line for a single day.
Is that happening now?
No, not right now, because it's not an illegal strike. So we're doing rotating strikes.
Right.
We're respecting the essential services plan, but that's what happened at the last strike in '99. There's still people from that strike that are kind of traumatized from that, because nurses had to pay for a year and a half on their paycheck the fines that they got from the strike. So every paycheck for a year and a half, you had a subtraction on your paycheck that was fines for the strike. So that was rough. that would
traumatize you for sure. Yeah, that would really mark you. So somebody named Pam you quoted her. She wants to send solidarity. She's a registered practical nurse who works in Emerge. Stand strong. Show those greedy government people that the labor movement is revived. Let's shut the country down, says Pam. Our Premier Ford in Ontario is horrible.
Ford, what a horrible.
I know. Like today, the news from Ontario is, we're going to have beer in the dépanneurs in Ontario. Yeehaw.
The health minister tweeted
deal.
that was...
Okay, Trevor Zimmerman, when did your own union start putting proactive resources into preparing for a strike? And Meredith McKean, I haven't heard any significant support from other political parties. Did I miss something? So I will jump in on that one. Quebec Solidaire, which is the third party, I guess you could say. After the CAQ, there's the Liberals, and then there's Quebec Solidaire. They have been absolutely rock solid on this. And the leader, who was a former student activist named Gabrielle Nadeau-Dubois, has given some absolutely great speeches in support of the Common Front.
But they were censored in the National Assembly. You are now not allowed anymore in the National Assembly in Quebec to say that women are exploited in this province. So those words, women's exploitation, were banned from the National Assembly. I think it was last week or the week before.
Right.
Because that's the line that saying nurses, teachers, all these women who are on strike are being exploited, and that's why. And the current government took offense to that and banned the use of the words women's exploitation at the National Assembly. So this is where we're at now.
This is like a new version of the cancel culture. It's like,
cancel culture has always come from the conservatives, from McCarthyism to blacklisting people and things like that. That's conservative through and through.
So I think I don't know. Did you want to say? I think we've gone over time. We're pretty much up against the clock now. It's almost 8. So did you want to say something in closing, Natalie? And maybe we'll reconvene after, like in January or at the end of January after the.
I just wanted to say thank you, and I'm super tired, so I'm sorry if I wasn't necessarily at my best, but you all are amazing. I love the Canadian Health Coalition. All the work that you do is truly awesome, and I'll try to, it'd be great if we could have maybe some kind of hybrid thing, maybe Ottawa or something at some point, and have more people from Quebec. We put this together really last minute, but next time we could have a lot more people, maybe a teacher or two, a support worker from, technical worker or something like that. From
somebody from the APTS, the other health worker,
to talk more about the details of that.
So just in closing, Joel French says, thanks so much for putting this on, enjoying this and learning lots from here in BC, where there's lots of interesting activity in healthcare and an NDP government in power. Great stuff. Looking forward to the next webcast. And thank you for this struggle. You are inspiring, says Meg Luxton. We will take support seriously. So really very lovely. Thank you very much to Tracy for pulling this all together. And to you, Natalie, for joining us. And
my pleasure.
Really,
anytime.
I heard some people chanting at the last demo that I went to. They said, El pueblo unido jamás será vencido. The people united will never be defeated.
That's a classic.
Yeah, and it was all these young teachers chanting it. It was really lovely to see. So
a lot of the teachers today are from the 2012, Les Castas. They're the Carré Rouge of the past. We actually have now also, you can wear a purple square. That started, I think, this week is a sign that you support the Common Front here.
Well, I'm going to rush out and get one. Absolutely. Yeah. Anyway, thank you so much for joining us. Thanks to everybody who joined us online. And we will keep you posted. And do check out our newsletter. We try and post stuff on our webpage, and we send out a weekly newsletter with updates on all of this kind of stuff. So we try and stay ahead of the curve. Courtesy Tracy, who is one of the people who keeps everybody on track. So thanks to everybody. Solidarity forever.
Thank you. Have a great night.
Have a great holiday, everybody.